Welcome back to McLaren Port Huron's Today's Health Program. Today I'm speaking with medical oncologist Dr. Alsawah about lymphoma. Doctor, before the break you talked about the different stages of lymphoma. Now, how do the stages 1 through 4 of lymphoma compare to the stages 1 through 4 of lung cancer or colon cancer? Are they the same or different?
They're very different. Thank you for asking this question. It's extremely important to point out that the stages of lymphoma is just for us to know within the same system of the lymphatic system. You have to think of the entire lymphatic system as one system. So when we are staging of lymphoma, we need to know how far within that one system the lymphoma has already been present. It doesn't mean that the cancer, for example, if it's a stage 4 lung cancer or colon cancer, it could mean that the cancer have left that organ and gone to another organ. And that's a different prognosis altogether. In lymphoma, a stage 4 lymphoma, all what it means is we have lymphoma in multiple areas, including the bone marrow. It doesn't mean that the lymphoma has spread elsewhere or the disease is incurable. It's not. It's just for us to prescribe the most appropriate treatment, that's all. So when somebody has stage 4 lymphoma, it's so much different than stage 4 lung cancer or colon cancer or kidney cancer. So thank you, that's very important.
Now, how do you determine which treatments to use for lymphoma?
The most important in determining treatment is, number one, is knowing exactly what kind of lymphomas, because lymphomas are divided into 3 levels based on how aggressive they are. Like if they are very aggressive, we call them high grade. We use the term grade, which is aggressiveness, versus the other extreme, which is a very low grade, and then the middle grade in between. Some of the low-grade lymphomas, sometimes we don't even treat them. We can watch them for a while and the patient would do well, versus the higher-end lymphoma, the very aggressive, need a very aggressive therapy. So we need to know what kind of lymphomas we are dealing with, number one. The second thing we need to know, again, go back to the staging of the lymphoma, how extensive it is within the lymphatic system to know what the appropriate treatment.
Now, what medical oncology treatment options are there available for lymphoma?
You know, it's very interesting. It's the improvements in what's treatment available for lymphoma in the last 10 years. It's very hard to keep up with. You know, when we started training, it was only few options available and some very harsh chemotherapy drugs that didn't even do that good of a job. Nowadays, the options are endless and all to the benefit of the patient, thank God. So it depends again on where the lymphoma. If it's very local area and it's a very low grade non-aggressive lymphoma, then just removing that area or removing that tumor and occasionally use some radiation therapy to follow, that might be enough. But if it's more involved within the lymphatic system, which many of them are, then we obviously have to use a treatment that involves the entire body, and then we're going to use combination of chemotherapy, immune therapy, which is amazing. I mean, the story of immune therapy is just amazing. It made a tremendous difference, and as a result, the outcome of patients with lymphoma nowadays is so much better.
Now, if the standard treatments for lymphoma are not effective, are there additional options that are available?
Absolutely. I mean, not only, we used to just had 2 or 3 different kinds of chemotherapy or immune therapy. If they didn't work, there's nothing else to do. Now we have, you know, other options like other more effective or more aggressive systemic therapy. And finally, if that's all not effective, we can refer the patient for a stem cell transplant, and that can still be a curative option for some patients.
Well, that offers a lot of hope to those with lymphoma that there are countless options available for them.
Of course.
Can you tell us a little bit more about the stem cell transplant?
Stem cell transplant basically is a concept where if you have a disease that the current treatment in the current safe doses that we can give is not able to get rid of it, we use much higher doses that can potentially get rid of the disease like lymphoma. The problem is that will damage our own bone marrow, our own stem cells within the bone marrow so much beyond repair. So what we do is we harvest the person's own bone marrow or stem cells and we freeze it give that person a very large dose of systemic therapy, like chemotherapy, that will get rid of the lymphoma, then turn around and give him back his own stem cells. And that will assure that the person will have healthy blood, healthy stem cell to survive, and the lymphoma is gone. Obviously, it's more involved and much more complicated than how I describe it. That is the concept of what stem cell and how it works. But it requires a very specific facility. Then we usually refer a patient to Karmanos Cancer Center in Detroit, and they are one of the best facilities for transplant, not just in a state, but throughout the nation.
Now, for patients with lymphoma, are there any special precautions that they need to take to keep themselves healthy while they're undergoing treatment?
Of course. I mean, the most important thing is stay healthy, live a healthy lifestyle, eat healthy. Yes, you need to eat some sugar. You need to eat some protein and a little bit of fat, not too much. But eat healthy, exercise, and also be careful because the lymphoma by itself is going to weaken a person's immune system. On top of it, some of the treatments we give the patient will make them even more immune compromised. So we tell them be careful of people who have germs and bugs. If you know that your grandkids have the snuffles and they have low-grade fever, just talk to them by the phone. Don't hug them. You'll have plenty of time to do so in the future. So just be careful. Stay away from areas that potentially can pass in germs and bugs to you.
Dr. Alsawah, this has been great information. Do you have any closing comments for our viewers?
The one thing that I want people to know that lymphoma is very much a curable disease, not just a treatable disease. It's potentially a very curable disease. And in the last 20 years or so, the options we have to treat patients and give them better chance of cure are endless. So any patient with lymphoma we see, we look at it. The first thing we do is we look at it like, this is a curable disease. I'm going to do everything I can to get rid of this disease. So this is a curable disease. It takes a team of healthcare workers. It takes medical oncologists, radiation oncologists, surgeons, and sometimes we refer the patient even for further advice, like at Karmanos or other facilities downtown in Detroit. But there's a lot of hope. We tell patients this is very much a curable disease, and just be patient with us.
Dr. Alsawah, thank you for joining us today.
Pleasure. Thank you so much for having me.
Stay with us. We'll be back after this break.